case presentation, and I'll discuss some cases also, remedies also, and then take up your question answers. So, welcome you all. I hope everybody joins in fast so that I can take some questions. In the meanwhile, some symptoms somebody had asked me, so I'll discuss that first. For example, patient had come and told me, doctor, there was a case where the patient had taken the rubric that during menses, if there is a very particular symptom, is that important or not to be taken. Now, see, whenever there is a physiological change or physiological challenge in the body, and how does that body react to that physiological challenge is very important. Especially, there are some symptoms which are aggravated before menses, like irritability is there, constipation is there, recurrent urination is there, headache is there, or falling of hair is there before menses or during menses or after menses. So these symptoms are very important because they are showing that whenever there is a challenge in the body is throwing out symptoms. So these symptoms, yes, definitely, if it is defining the whole personality, if it is defining the whole patient, then you have to take this rubric for prescription or this symptom for prescription. For example, whenever you get a case of restlessness, restlessness. Now, restlessness is a very, very big rubric. Restlessness is a very, very big rubric, but the sub rubrics of restlessness becomes more important, because if you just take one rubric, restlessness, and you feel, yeah, arsenic is restless, and you always think about arsenic, then you might fail sometimes. Like, for instance, there are persons who are so restless that they cannot sit in one position. They cannot sit. So this restlessness can be interpreted in different forms. For example, restlessness which drives the patient from place to place. We have one rubric. We have one rubric where the patient is that restlessness is very hysterical, or there is restlessness, so much restlessness that the patient has to move continuously. The patient has to move constantly. So these are different type of restlessness rubrics where you have to first understand what is the patient trying to tell you and interpret in that patient's language and then give the remedy. For example, if there is a rubric called restlessness, the patient he has to move constantly. He must move constantly. In that, you see the remedy, a very interesting remedy, Rustox. Simple. But there is one more rubric where it is written that restlessness drives the patient from place to place. Now, see, it has a very similar meaning, but of course, something different also. If you see the rubric restlessness, when the patient is driven from place to place, then you have remedies like lachesis, we have calcarea phos, we have belladonna. But when the patient says, if you take the rubric restlessness must move constantly, he has to move constantly, then the remedy becomes Rustox, first grade. Of course, there are other remedies like epismel is there, arsenic is there, calibrom is there, but Rustox is important. So these are the importance of symptom and rubric that you have to take for prescription, because if you take a wrong rubric, if you select a wrong rubric, then the whole case and the whole remedy is absolutely changed. Because in homeopathy, see what happens, most of us, we know arsenic as restlessness, and there are so many remedies, which have restlessness. Like, for instance, there are remedies which are restlessness and excitable, very excitable when they're restless. And if you go and check the remedy, arsenic is not there. We have chamomilla, we have hyoscyamus. In fact, we have ignitia also, where the restlessness, excitable restlessness. Or you have restlessness because of exertion. The patient does so much exertion, so much work, that after that the patient becomes restless. So we have remedies, Muxol. In fact, if you have prescribed Muxol and if you have seen Muxol patient, from least exertion, the patient becomes restless. And that is Muxol, what I see in my practice. Of course, the Muxol patient mind is there, very vindictive, malicious, everything is there. But this becomes very important. This becomes so important, that restlessness from least excitement, think of Muxol. And of course, one remedy that you should think also, which according to my experience, and that is Tarantula. So welcome, Namaste, Dr. Gopal, Dr. Alexandra, Dr. Lisa. When your first remedy stops working after 2 years, I assume there is an obstacle cure. I look for a management remedy for a nosoda. Yeah, when the first remedy stops working after a week or two, if you have prescribed the remedy on similimum, So in 1 or 2 weeks, it should not stop working. If you feel that the remedy is right and it has stopped working or the action has slowed down, repeat that remedy, repeat that remedy in the same potency once. It is said that if you don't repeat the remedy, it's thumb rule that you have to repeat the remedy in same potency twice, as Dr. Kenter said, and then either change the remedy or increase the potency. For this, Dr. Lisa, I would like to tell you that read Kent's 12 observation. If you read Kent's 12 observation, you will exactly know what to do when the remedy has failed or it has stopped working. If you go through that, then you'll understand what to give and what not to give. You look for a miasmatic nosode also. Yeah, everybody says that push it with a nosode, but it is basically all in the mind. There's no need for nosode or give an intercurrent remedy within 2 weeks. If the patient is continuing of 3 or 4 months, then you find an obstacle to cure, then you can maybe give an intercurrent remedy depending on the case. So it is so important that you first understand how to repeat. That is important. Okay. How to master Mathematics. Yeah, remember one thing, Dr. Guptaraj, that you see, I feel that nobody can master Mathematics because there are so many remedies. There are so many symptoms in a particular remedy, and every sometime every week you find a new remedy getting proved, a new theme coming, and so many remedies coming that we attend a seminar and we find this theme is good, this new remedy is working well, and we normally forget the other polycrest remedies. So my suggestion to all doctors wherever I am teaching in school and colleges, read your polycrest remedy very nice, very thoroughly, because there are some symptoms, or you can say there are a lot of symptoms in polycrest remedies which we are not able to understand or appreciate because we are not taught. Our angle is very slow, confined to those remedies like Staphylococcus aureus for elements from vaccination, or Kalika elements from overstretching and sweating and weakness. And so our look of that remedy is very precise and very, I would say, narrow. So you have to increase that view of the remedy. First, try to see what the polycrest remedy, like 25-30 polycrest remedy, automatically you will start getting results. And of course, keep reading Mathematics every day, because whenever you start reading Mathematics every day you get a different thought of the same remedy. So don't stop reading Mathematics, and that is how I have developed my Mathematics and my practice. And by the grace of God, I'm doing very well in practice and in teaching also. And Dr. Robin, I am now taking Mathematics classes for students, the third year students and the final year students, on my Google Meet and Zoom, because I am attached to few colleges. And they are finding it very interesting because I keep on telling them the same symptoms, the basics of the remedy, remember that remedy, and keep reading, and then it's helping them and their Mathematics is improving, as I feel. So keep reading every day. That's the main thing. यूरिन में जलन व यूरिन की थार कमजोर हो 50 साल का आदमी. इसी यूरिन की थार कमजोर हो, or you feel that, see, for this you must first understand whether the patient is suffering from any problems during urination. For example, if the patient is suffering from stricture. Now if the patient is suffering from stricture, then automatically the stream would be narrow and slow, and he's 70 years of age, so we do expect that there will be a stricture in the urination. So you must first remember the generalized remedy for stricture. Like we have remedies like clematis, remedies like cantharis, nitric acid, petroleum, pulsatilla. These are the very, very important remedy for stricture, and then you can start to differentiate these remedies and then get to the prescription. Sir, JAM is second BHMS. Okay, you are in second BHMS. Which books for the best Mathematics? Now see, I can tell you few books which I have found very useful in my practice. But see, every doctor, what I feel, every doctor, every physician has a pre-inclination towards a particular book. You find this book very nice. I might find maybe Boric Mathematics or Kent's lecture very nice, but you might find Clark or Allen's keynote very nice, depending on your wavelength and your inclination and your disposition, or called tendency to. When we were in the second year and studying, we used to read Allen's keynote, we used to read Dubé, Boric Mathematics and Kent's. In final year, I started reading Clark Mathematical and hearing guiding symptoms. Then gradually every day we used to brush up, and I used to make notes. So I have handwritten notes of all the remedies which are there in the syllabus we had in a syllabus 25 years back. So I have all handwritten notes accumulated from different authors. Like we used to refer, I have to refer a lot of books, and I've made notes. So now those notes, basically when I read today, it has compilation of all the authors, and it's a big mathematica for me. So I basically refer that, and you should follow that, refer everything, the basic books, and try to analyze and make notes for yourself. That will help you in future practice. Sweating of vertex during eating, no rubric, which remedy? Yeah, see, this is a very, very common symptom that the patient says that I have perspiration during eating. So there are some remedies where there is perspiration eating while. But see, I would not tell you to take this symptom for prescription, because this sometimes becomes, see, a very normal symptom for lot of cases. So if you want the remedies you should remember in these cases. You can write down carboage, carbon sulf, mercury, nitric acid. Whatever I can remember in this moment. Sweating on a vertex during, okay. Which remedy, which I have told you, Dr. Anjali, which is the correct way to dispense the medicines? See, when correct way to dispense the medicine, normally when you prescribe one dose, take 4 tablets in small bottle, put the liquid, and wait for half an hour, the liquid settles down, and give the medicines. That is what I understood from the question. Sweating at nape of neck while experiencing acidity. Again, no rubric. No, sweating while in the nape of neck. See, acidity basically is a very relative term. So you have to understand what is the patient trying to tell you. Now, if the patient is trying to tell you that I have this perspiration when I feel a lot of palpitation, ghabrat, burning, so that is a bit different than acidity. So there is no rubric called acidity. So you have to see the symptom what the patient telling you. Normally, what happens? The patient comes and tells you that whenever I'm anxious, घबराहट होती है, मुझे लगता बहुत एसिड लगता है, घबराहट होती है, उस समय बहुत पसीना आता है. Then you have to think remedies like arsenic album, we have manganum, we have phosphoric acid, we have fluoric acid, ferrum metallicum, calcarea, chamomilla, china. So you have to see anxiety. And then if the patient tells you that after eating the dinner I have anxiety, then the remedy changes. After eating evening or in the morning, then the remedy changes. So you have to ask a precise question rather than asking a disease question. Good afternoon, Dr. Abhishek. Dr. Mishra ji, good afternoon. कैसे हैं आप? ठीक है? So Mathematics is, I would extend further. It's a very, very interesting subject and topic, So it is very important that just open the book whichever you feel that is, right? Because every book, all the basic books, have the basic symptoms. For example, if you open arsenic album, so any Mathematics, you open any Mathematics, simple thing in arsenic that will be there in all the Mathematics. Arsenic has to be restless. Arsenic has to have anticipation. Arsenic is thirstless. Or arsenic album has lot of prostration and sinking and lot of anguish if the patient is irritable. This will be present in all the Mathematics. The most important thing is you have to understand how to interpret that symptom in the patient's language and then how to give the remedy. That is important. No? For example, I'll tell you arsenic. It is written in Mathematics that arsenic is mentally restless but physically weak to move. Mentally restless but physically too weak to move. That is arsenic. Cannot rest in any places. Changing places continuously. This is arsenic. कभी ये बेड पे सोएगा, कभी वो बेड पे सोएगा, कभी यहाँ बैठेगा, कभी वहाँ बैठेगा. Arsenic album. So this is how you have to understand the remedies and then prescribe the remedies. Even in arsenic it is written cannot bear the smell or sight of the food. So you must know comparative Mathematics. आर्सेनिक के साथ में कौन सा आना चाहिए? कोल्चिकम भी आना चाहिए, सीपिया भी आना चाहिए. तो भैया कोल्चिकम भी रेस्टलेस है, कैसा है? सीपिया भी रेस्टलेस है, कैसा है? आर्सेनिक का डिफरेंस क्या है? फिर मैच विद द थर्स्ट and then you get the remedy. So this is how you have to read your Mathematics in comparative form, the basic forms. Then you try to develop or enhance your knowledge through case taking, through your years of practice and the results which you see in your practice. See, I don't know what is there in Zomeo, but see, 3 mark, 2 marking symptoms, basically what happens are good for a good. But if the rubric contains all the remedy, that means that remedy, all the remedies are important. So don't always stick on that 3 marking symptoms or 2 marking symptom. It depends on which author has taken which symptom. That is important. So don't depend on that. If that remedy, if that rubric contains 10 remedies, only 3 are 3 marking and 3 are 1 marking. So that 1 marking remedy is also important as good as 3 marking, because it has shown that symptom in the patient. Okay. Otherwise, what will happen? All the polycrest will come in the repertory chart because they are well proved and they have lots of 3 marking symptoms. And the rare remedies or the infrequently used remedies or the remedy which are not proved totally have only 1 mark in that rubric, and you will never get that remedy in the repertory chart. Okay, I hope you understand. If we give a dry dose 30 c not in water or for an acute, okay, I give one dose, the analysis 30 minutes, then repeat every 2 hourly, reduce on improvement. Yeah, you can do that. In this, I would like to suggest that use the LM potency, So in LM potency, Hahnemann has written that you can repeat that in every 10 minutes also. So whenever there's a severe case of migraine, severe ureteric colic, severe stone pain, severe trigeminal neuralgia, severe migraine. So in this, what I suggest that you should repeat in LM potency. LM potency can be repeated in every stroke of the medicine, changes the potency of medicine. So every next dose basically is more than the preceding potency. So you are basically marginally increasing the dose of the medicine also and prescribing the same medicine also, and repetition is also important. So you can try LM potency and that will give you good results. Sir, just saw your video on sulfur. I have a question. I repetize a case where sulfur and conium came first grade. Can I give sulfur 1 m single dose for chronic overgrowth? Beat 5 grade. Yeah, you can give sulfur 1 m, one dose. Sulfur, if you are prescribing 1 m, usually you should not repeat. One dose and wait. What's the behavior of disgust patient at the clinic? See, disgust basically is a rubric which you interpret, a disgusting feeling, whenever a husband says, a wife says that I have seen husband sleeping with some other woman, that causes lot of, I feel very bad. That is so disgusting. So that you have to interpret the symptom. The patient will, if the English is very good of the patient, he might say disgusting, but disgust is what you interpret from the symptom. So just for that, if you don't know, then please do go in Google and see the meaning of disgust. And then automatically you start getting the meaning of disgust. Disgust means अनप्लेजेंट, मतलब बहुत बुरा मतलब अनप्लेजेंट चीज, इसको बोलते डिस्गस्ट बोलते हैं हम। या हम बोलते हैं कि स्ट्रॉन्ग फीलिंग ऑफ डिसइंक्लिनेशन, मतलब ये खाना मुझे पसंद नहीं है, तो उसका मतलब डिस्गस्ट हो गया। सो उसको इंटरप्रेट करना पड़ेगा आपको, पेशेंट नहीं बोलेंगे अनलेस कि पेशेंट इंग्लिश ही काफी अच्छा है, ही टेल्स हर सिम्टम वो रूब्रिक में बताता, तो अलग बात है वो। Why lycopodium is not mentioned in knife impulse to stab? Why it is not mentioned, that I cannot tell you, because I have not read Zomeo, so I don't use it, so I don't know why it is not given. But whenever I am teaching, I will always say one thing: the differentiation of the selection of the remedy depends on your knowledge of mater medica. When you take a repertory chart, there are 3 or 4 medicines that comes on the repertory chart, and then it is your knowledge of mater medica that will differentiate these remedies. That is important. So mater medica knowledge is very important. Like for instance, I have told you other symptoms of abrotenum, that is inhuman, and lot of symptoms which are not present in the repertory, like sulfur, written in Kent's mater medica. The patient tries and fails, is written in mater medica but not in the repertory. So your mater medica has to be very important. How to charge patient at the beginning of your practice? I would definitely suggest nominal charge should be there depending on your locality and your area, and because first it is important to gain the confidence and faith of the patient. And I can tell you in 20 years of practice that money will always flow where there are results. Mark my words, money will always flow when you show results. It is not important that how good a teacher you are, how good are you in academics, how good are you in giving lectures. but it is important how good you are in giving the results that will have a, what you call, easy flow of money in your clinic. So don't worry about that, that will flow automatically. LM difficult, which potency is not local? Yeah, LM is sometimes very difficult. In that case, if you think that you have to repeat, so you have to give in a water dose, a split dose, put that one dose in water and then tell the patient to take 1 hourly or 2 hourly depending upon your intensity of complaints. Entry point of nasal polyp. Now see, nasal polyp, if you see whatever entry point is there, it depends on case taking. Always I remember, I always tell the students, aphorism number 6, the unprejudiced observer. That is very important. Of course, if you open some of the repertories and just directly put nasal polyp, you can get lot of remedies, and these remedies of course will act also, no, in nasal polyp. For example, if you open the repertory, if you open the nose chapter and just type polyp, so I'll tell you my results. For examples, one remedy, Teucrium marum verum, one Sanguinaria nitricum, not canadensis. I have seen results. Teucrium marum verum, Sanguinaria nitricum, and third is Agriphus nut. Have given me very, very good results when I have used them locally in my practice. Without case taking, just give for the disease, I have got good results. So you can try these remedies. Patient having body ache, pain more in the left after exercise, feeling of stretching and tiredness in muscles after little work. The continues even after 10 days of exercise. MacFox says, no, it is not MacFox 6x. So you have to think remedies. Two remedies are very, very important. The first is sulfur iode and second is thyroidinum. And of course, third remedy that you should think about is Kalicarb. Controversial topic. No, the topic is never controversial. Sorry, we have one. Severe migraine, boring pain into the ears, left jaw, better by walking. See, whenever you are treating a case of migraine, so it is very important to understand what is the cause of that severe headache. Because in migraines there are symptoms like the patient comes and tells you, sir, whenever there's pain, no, so I have to sleep in the dark. Whenever somebody opens the light, I start getting migraine. Whenever I have been woken from my half sleeps, I get migraine. Whenever I am empty stomach, I get migraine. Whenever there's loud noise, I get migraine. So when I go in the sun, I get migraine. So these basically are very, very common symptoms of migraine, and if you prescribe in those common symptoms, you will not get good results. You will get only temporary results. Now, if you have seen a case where the patient comes and tells you that motion ameliorates. Now, so there are I would not tell you one, but there are so many remedies where the patient feels that walking general, the patient feels better. Now, if you want to write, you can write the rubrics, but I would have taken more deeper that walking in open air better, or walking slowly better, or walking fast better. But generalized ameliorated from walking, you write the remedies: phosphorus, rhododendron, rustox, lycopodium. Controversial topic. No, constitutional remedy is never a constitutional controversy. In acute condition, whatever is seen, if you have read miasms, if you have read totality of symptoms and the laws of homeopathy from Hahnemann's writings, it is very easy. Whatever PQRS symptom, whatever symptom which is the defining symptom of that patient in acute disease, take that symptom and prescribe. Sometimes what happens, those acute symptoms or PQRS symptoms basically are the symptoms of the patient and it becomes a chronic remedy. So in acute case, whatever symptom the body throws in front of you, that is the remedy. पेशेंट कहता है मेरे नेजल पॉलिप ठीक हो जाएगा तो हमारे सब बीमारी ठीक हो जाएंगी। या वो तो नेजल पॉलिप में क्या होता है मिश्रा जी, जैसे मैंने आपको बताया कि पेशेंट को इतनी तकलीफ होती है कि वो बोलता है भैया आप कुछ भी करो, ये मेरा नेजल पॉलिप ठीक कर दो, मेरा सब कुछ ठीक हो जाएगा। ये सब चीज़ें पेशेंट बोलेगा। जैसे कोई पेशेंट आएगा अभी सियाटिका के लिए, बोला डॉक्टर साहब मेरे सियाटिका ठीक कर दो, बाकी सब ठीक हो जाएगा। फिर को माइग्रेन कराएंगे, डॉक्टर साहब बस मेरे ठीक कर दो, बाकी मेरा सब ठीक हो जाएगा। सो पेशेंट को जितनी ज़्यादा तकलीफ होंगी वैसे बोलने वाला है। और पॉलिप के लिए ये 3-4 रेमेडी मैंने बताया बहुत इंपॉर्टेंट है। जैसे मैंने बताया ट्यूक्रियम मारम वेरम, सैंगेलोरा नाइट्रिकम या फिर एग्रीफस नट, ये सब रेमेडीज है ना, ये बहुत इंपॉर्टेंट है। अगर आपने देखा होगा केंट के केसेस, उसने कैलकेरिया आयोड या कैलकेरिया सिलिकेटा बहुत यूज किया है, ट्यूबरकुलम बहुत यूज किया है। सो ये 5-6 रेमेडीज पॉलिप के लिए बहुत इंपॉर्टेंट है, इसके बारे में आप सोच सकते हैं और उससे अच्छे रिजल्ट मिलते भी है। What is the use of complementary medicine? Sometimes what happens, sometimes what happens that, I'll give an example. If you are treating a case, of, for example, migraine, and the patient is much better, but you feel that the remedy is kali carb maybe, but it is not showing good results. So we have to have a remedy which is very close to kali carb, but not kali carb. So it is written Nux Omega is a complementary to kali carb. In that case, Nux Omega would work and finish up the case. That is the importance of a complementary remedy. Can you please throw some light on direction of cure which returned old symptom? Yeah, this is basically given in all the books of college books. You can go and just start an open Herring's law of cure and you get all the types of cure, and that's very interesting. The old symptoms come and exteriorization of symptom from more important organ to less important organ, from the center to periphery. This you can see when your case taking is very good, your prescriptions are very good, and you are on target of the cerebellum. ये रेमेडी फेल हो चुकी है, बाप रे, आपने मतलब सब यूज कर लिए। तो देखिए, अगर आपको लग रहा है कि ये रेमेडी फेल हो चुकी है, ओके मिश्रा जी, और फिर आपको लग रहा है कि अब क्या दवा देना, तो फिर उसके बाद आपको देखना पड़ेगा कि वो नेजल पॉलिप है वो लेफ्ट साइड पे है कि राइट साइड पे, और नेजल पॉलिप कैसे तकलीफ क्या हो रही पेशेंट को। फॉर एग्जाम्पल बताता हूँ मैं, कभी कभी नेजल पॉलिप के अंदर ब्लीडिंग होना शुरू हो जाती है, कभी कभी नेजल पॉलिप के अंदर ऐसे तो नाक में फूलन आ गई है, कभी कभी लगता है कि नेजल पॉलिप कैसे नाक पूरा बंद हो गया है, कभी कभी लगता है कि नेजल पॉलिप के छींके बहुत आ रही है। तो फिर ये सिम्टम आप पेशेंट के लीजिए और फिर प्रिस्क्राइब कीजिए। फॉर एग्जाम्पल, अगर लेफ्ट साइड पे नेजल पॉलिप है तो आप सोच सकते हैं रेमेडी मर्क आइडोरूब या एपिस्मेल, राइट साइड पे है तो कैलकेरिया का आप सोच सकते हैं, या फिर नेजल पॉलिप से बहुत जल्दी ब्लड निकल जाता है तो उसमें फॉस्फोरस भी आता है, उसमें थूजा भी आता है, या फिर नेजल पॉलिप कैसे उसको ऐसा लगता है नाक बहुत फूल गया है, उसमें बहुत रेयर दवाई जो मैंने यूज़ की है वो हेकला लावा। और कभी कभी पेशेंट क्या बोलता है कि नेजल पॉलिप मेरा है और इतना पॉलिप बढ़ गया कि पूरा सर में दुखता है, सर पूरा जाम हो जाता है, उसके अंदर भी हेकला लावा काम करता है। या फिर पेशेंट बोलता है कि नेजल पॉलिप इतना ज़्यादा है कि मैं सांस भी ले नहीं पाता, उसके अंदर भी हेकला लावा है और मेटालिकम और कैलकेरिया कार्ब है। सो अगर आप धीरे धीरे इसको डिफ्रेंशिएट करना शुरू करेंगे तो रेमेडी फिर चेंज होती जाएंगी। मैंने कहा ना कि सिम्टम बहुत इंपॉर्टेंट है, आप किस सिम्टम पे प्रिस्क्राइब कर रहे हैं ये बहुत इंपॉर्टेंट है। Salamandra मैंने प्रैक्टिस में, आई हैव नॉट यूज दैट इन प्रैक्टिस, एंड आई हैव नॉट use this principle that Crotalus and Salamander completes cure of lachesis. I have not done. I have got very good results with lachesis, and whenever a lachesis is given, I don't give lachesis to complete the cure of snakes. So I cannot answer this question. If we use the 30 c water for an acute, please suggest frequency of dose and how long. When I repeat every 2-3 hourly, my patients begin to prove the remedy. No, Dr. Lisa, they will not prove the remedy. 4 pills in half cup of water, stir it and take 1 spoon every 2 hourly, 3 hourly. Still, the symptoms are better. And if you find that the patient is proving, wait for some times. Automatically, the symptoms will weigh off automatically. There's no need to give an antidote. Neither the patient will have those proving symptoms for a long time because you have given in split doses, minimum doses, water doses. So it will not enter the economy very fast. हेकला लावा, मिश्रा जी वेरी गुड। सो आप जब भी सवाल मुझे से करेंगे तो अगर बाई चांस बेसिक सवाल में आंसर नहीं मिलता तो फिर हमको आगे जाना पड़ेगा। इसलिए मैं हमेशा बोलता हूँ जब भी आपको सिम्टम लेते हैं पेशेंट का तो सिम्टम को डिफाइन कीजिए बराबर से। हेकला लावा बहुत अच्छी दवाई है, मतलब दवाई तो सभी अच्छी है बट हेकला लावा के अंदर भी बहुत अच्छे रिजल्ट है। How long to wait before revisiting prescription? See, whenever if you are treating a case, for example, if I am treating a case of very chronic complaints, for example, I had cases, when I have cases basically of retinal detachment or goiter, big goiters and all. So basically what happens, I wait for at least 6 weeks, 6 to 8 weeks before I change the medicine, because I sometimes feel that waiting is definitely better rather than changing or repeating the dose, because For the first dose, we try very hard. We give everything in that case, and we feel that this should work. So at least I wait for 6 to 8 weeks before I change the medicine. Salam, hello. My lady has ectopic pregnancy. I gave her consul calcare on Thursday, Friday morning. She has very mild pain and very light bleeding. Doctor will let her know blood test results. They are saying fallopian tube will need to be removed if levels have gone up. Your comments. Yeah, ectopic pregnancy basically what cases I have seen in my practice. What happens, ectopic means that the normal means the nature has the body is not following the nature's law. Simple. The pregnancy which has to happen in the uterine cavity has happened in the fallopian tube, so the body is not following the nature's law. So we have to find during case taking that what has happened because of which the body is not following the nature's law. In some, you'll be surprised that sometimes what happens, I had a case where I had given that case patient a dose of kali brome, and automatically the ectopic came to the uterus and the patient was normal. So the doctor told that maybe that previously the report was not so confirmative, and maybe that it was normal, so it would have happened by chance. But if you feel that the ectopic is still in the fallopian tube, so the treatment would be to go and either clean the fallopian tube or take out the fallopian tube. That would be a bit risky, because next pregnancy would be a problem. So in this case, you have to give a remedy where the fetus, if at all, maybe not alive, disperses itself in the tube or the cavity and goes off, and you can say a missed abortion or a abortion happens, so that at least the fallopian tube is saved, is compensated. So you have to do that. So if you have given calcarea, wait for some time and then see what are the values, and then we can think of changing the remedy. In acute case, Dr. Lisa, I would say that whenever the symptoms are there, for example, if I'm treating a case of fever, I would see that the patient starts feeling slight better at least within 4 to 6 hours. She has come, she was soon the coil, and after it was removed, she got pregnant within a few weeks. Oops, had the coil. She was soon no, I can't get the coil means what? I don't know. Coil means you're telling that electric wire which we coil. I don't know exactly. You can again put the question, Dr. Raha. Rheumatic leg, ankles complaint, how to Rustox and radium brome compare with each other. We should one thing of radium brome in patients. No. See, I don't basically follow these type of practice too much in my practice. Hardly maybe one in maybe 1,000 cases. That after this remedy, this works very well. I feel that if your remedy is right, if the stimulum is right, it has to work. If it is not working, maybe you have missed something in your prescription, or you have to increase the potency or repeat the dose or this way. And in this case, like if this remedy does not work, this works faster. I have not much experience in my practice. Acha, contraceptive pills she had removed. Okay. So maybe the body has reacted very violently because of the pills are removed, and immediately she got conceived. So the body has. But we have to see that why did the ectopic the pregnancy happen in the uterus. So the nature of the patient is important. There are a lot of cases where after the removal of the contraceptive, the patient conceives and the conception is normal. But that state of mind where the patient basically conceived a few days before or few months before, what thought was persistent in the patient's mind at the time of conception, that will lead to the area and the level of conception, either in the fallopian tube or in the infundibula or the fimbrials or the uterine cavity. It depends on that thought at that day or at that time of conception. So yeah, I think calcarea cap should you should wait for some time, and then see. There's one more question on Skype. Just let me, yeah. So, question on the mobile. Just a minute. So, one more question. I think it's the same question regarding Mater Medica, how to study. See, Mater Medica, there are no hard and fast thing how to study, because the same question is there today, that how to study. See, Mater Medica, basically, if you understand, is a very wide area, and remembering symptoms is different, but there are some entry points of some remedies, which you have to understand and read every day to get the feel of the remedy. See, you have to get the feel of the remedy. When you get the feel of the remedy, you automatically start getting the remedy in its depth. We had in school days our English teacher. So he used to always tell us, you have to get the feel of the word. I never understood what is the meaning of to get the feel of the word. You have to get the feel of the word. Once you get the feel of the word, you automatically start pronouncing it better. You automatically stop making mistakes in spelling mistakes and all. In the same, I would like to tell you, you have to get the feel of the remedy. When you get the feel of the remedy, automatically everything starts working. Also, what about exposure of homeopathy medicines to X-ray machines at airport and radiations which aeroplanes in is in? No, the constitutions are strong enough to take care of this. Don't worry about that. We have nurtured our body, and the body has grown so high that they are used to that. So don't worry about that. She has 2 kids from previous age who was very abusive, so not very trusting many people. She said for her security, her kids and self important. So okay. So basically, she has married because she feels that she has to have some security, some support, and the life would be beautiful. So basically, it's a compromise. So whenever there's a compromise, the body also compromises. Fine. So calcarea is a good prescription. I think you should wait for calcarea, and whatever reaction comes after that, you can contact me, and we'll see what happens. It's a good prescription. It's okay. What will be the one remedy can be give for different types of autoimmune disorders? अरे मिश्रा जी, ऑटोइम्यून डिसऑर्डर हम आपसे पूछे कि भाई कोई एक कारण बताइए, मेंटल कारण जिससे हर आदमी को ऑटोइम्यून डिसीज हो सकती है, तो हम एक रेमेडी बता सकते हैं हर आदमी के लिए. बट किसी आदमी को एक कारण से ऑटोइम्यून डिसीज होती है, वही आदमी को वही कारण से कोई बीमारी नहीं होती. फॉर एग्जांपल, जैसे हम बोलते हैं कि भाई अपने घर में बहुत तकलीफ हो गई, कोई गुजर गया और पेशेंट को बहुत दिल पे बात लग गई, उसके 2 बच्चे, एक को ऑटोइम्यून डिसीज हो गया, एक को कुछ भी नहीं हुआ. सो अभी वो बच्चे का ससेप्टिबिलिटी बहुत वीक है, इसलिए उसको बीमार हो गया. सो अब ऑटोइम्यून डिसऑर्डर्स का मतलब है कि वो ख्याल, वो थॉट प्रोसेस, वो ऑटोमेटिक थॉट प्रोसेस क्या है जिसकी वजह से इसकी बॉडी ने इतना रिएक्शन दिया है. सो हर केस में डिफरेंट होगा मिश्रा जी. व्हाट विल बी द वन रेमेडी? ओके, यस. सो आप समझिए थोड़ा मिश्रा जी, आप समझ गए. पेशेंट हैज प्रिकॉर्डियन लाइनिंग ऑफ हार्ट रिमूव सर्जिकली बिकॉज इट वॉज कॉन्स्टिट्यूटिंग द हार्ट. ऑर्गन सपोर्ट cardiac tincture. What is the remedy? Okay, pericardial lining. See, now this is a very very important symptom, that the lining has been removed. Lining has been removed. Lining have been removed. Now see what happens in this case. 2 or 3 things are very very important. Now crataegus is a remedy. Whenever we are prescribing crataegus as a remedy, it has a very very interesting symptom in boric mater medica, that it has a solvent power over the crustaceous and the calcareous deposits in the arteries. So whenever there is deposits in the arteries, there is coronary artery block, the blood supply to the heart is compromised, and the heart starts shouting. Now in this case, what has happened? The pericardial membrane has been removed. So crataegus will not do anything in this case. So in this case, what will happen, that the remedies that should be thought of in this case, where I would say, first of all, before thinking the remedies, you have to see how is the patient reacting to this disease pathology. Means if this is removed and the patient is showing some symptoms, then only give some remedy. Because if the patient is not showing any symptom, then you should not give remedy, because the patient or the constitution is able to adjust with this operation also, and it has no problem. So rather than giving the medicine, just wait for some time and then give the medicine. No, I answered the question, doctor. What do I say in that aeroplane and all? There's no problem with the radiation and all. I feel that the constitutions have been strong enough to fight these radiations because it is everywhere now. So it has become the part of the constitution. That's why. And the radium brom questions, which basically say this after this remedy follow this remedy. I have not used this much in my practice that after this remedy this follows. I believe the remedy is that it should work. If it does not work, then increase the potency, repeat the dose, give an intercurrent depending on the case. Sir, in some case, laboratory for RA factor checked diarrhea after loss of fluid checked every day. Long. Yeah. We have. So in this case, Dr. Vinogopal, only abrotanum is not important. You can go in the rubric metastasis, and there are a lot of remedies. So go in that rubric. Abrotanum is 3 marking, but there are other remedies also, and try to compare the symptoms of the patient and then you prescribe the remedy rather than just prescribing the remedy. 25 years old lady with galactosile दिखा रहा है राइट साइड 2 यार राइट साइड से ब्लड निकल रहा है दबाने पे ब्लैक कलर का एंड अफेक्टेड ब्रेस्ट छोटा हो गया है नॉट रिलीव बाय एलोपैथी या गैलेक्टोसिल अगर पेशेंट को है दबाने से ब्लड निकल रहा है राइट साइड पे है दैट मीन्स वहाँ पे इन्फ्लेमेशन है पेन है राइट साइड है तो आप सोच सकते हैं बेलोडोना सोच सकते हैं आप फाइटोलेका सोच सकते हैं आप कोई नहीं मैकुलेटम सोच सकते हैं बट अगर पस निकल रहा है तो आप फर्स्ट सोचिए बेलोडोना सेकंड सोचिए फाइटोलेका और थर्ड सोचिए बहुत रेयर रेमेडी मैम जो मैं प्रिस्क्राइब करता हूँ वो है मायरेस्टिका एंड ये केस के अंदर आप और एक चीज़ कर सकते हैं एजेटेरिक टेंडिका और इस्निशिया टिंचर से उसको क्लीन करने बोल सकते हैं कैलेंडुला टिंचर से क्लीन करने बोल सकते हैं आप सो दैट इन्फेक्शन या पस या जो भी रहेगा वो ग्रो नहीं हो पाएंगे उसके अंदर Well, during COVID, she felt the heart is being whacked in her chest. Now recovering, but afraid to move too fast. Yeah, so basically, the problem is in the mind. So you have to take the case of mind because the heart is showing good results. So you have to take care of the fear and take care. Heart is whacked is a quite a normal symptom which a lot of people had during Corona. So you have to take the symptoms of anxiety, anguish, fear, and then and give the remedy rather than this remedy for the pericardium. क्या सुम्बुल हार्ट ब्लॉक को ठीक करेगा अर्जुना के साथ बिल्कुल कर सकता है सुम्बुल बहुत एक अच्छी रेमेडी है और सुम्बुल मैंने भी यूज़ किया प्रैक्टिस में आप इसको अगर बराबर से यूज़ करेंगे तो हार्ट ब्लॉक तो निकल सकता नहीं निकल सकता हम ये नहीं बोल सकते बट सुम्बुल का डेफिनेटली बहुत इंपॉर्टेंट एक्शन है हार्ट के अंदर और अर्जुना तो आपने देखा है अर्जुना बेसिकली देखा जाए तो एक ड्रग है जो आयुर्वेदिक में बहुत अच्छा यूज़ करते हैं इन लोग जैसे अर्जुन अरिस्ट करके दवाई है वो भी बहुत अच्छा काम करती है और मैं आपको ये बताऊंगा मिश्रा जी जब भी अगर कोई चेस्ट पेन का पेशेंट आ रहा हो हार्ट का पेशेंट आ रहा हो आपको रिजल्ट नहीं आ रहा हो तो आप डेफिनेटली अर्जुना यूज़ कर सकते हैं वो बहुत अच्छे रिजल्ट देता है सुम्बुल के अंदर भी बहुत अच्छे सिम्टम लिखे हुए अगर आपने सिम्बुल खोला होगा तो सुम्बुल के अंदर क्या है कि उसमें लिखा है कि बोरिक मटेरिया में कि उसका एक 2x पोटेंसी बहुत अच्छा काम करता है 2x पोटेंसी सो आप वो भी ट्राई करके देख सकते हैं सुम्बुल के अंदर अर्जुना तो बहुत प्रूफ दवाई है और ये डेफिनेटली काम करता है जैसे अगर आपने सुम्बुल पढ़ा होगा तो सुम्बुल में लिखा हुआ है कि इट इज़ अ रेमेडी फॉर जैसे आप सुम्बुल में लिखा हुआ है कि भाई एक डॉक्टर है जो जिनका नाम मुझे नहीं पता है उन्होंने क्या किया था पेशेंट को सुम्बुल 2x दिया था हर 3-3 घंटे में एथेरोस्क्लेरोसिस के लिए और उससे से उसको बहुत अच्छे रिजल्ट मिला था डॉक्टर का नाम मुझे याद नहीं आ रहा सो उन्होंने सुम्बुल 2x दिया था हर 3-3 घंटे में तो आप भी ट्राई कर सकते हैं अर्जुना भी मदर टेंशन में बहुत अच्छा काम करता है जो छाती का हेवीनेस है जो छाती में पेन है वो पूरा अर्जुना कम कर देता है 2 months ago old baby having sliding right hernia which leads हर्निया है और अगर वो सैक को पेस करके बाहर नहीं आया है रिड्यूसेबल है तो हम क्योर के लिए सोच सकते हैं बट अगर सैक के बाहर आ गया है इट हैज़ कम आउटसाइड दिस सैक द रिंग हैज़ ब्रोकन देन यू हैव टू थिंक ऑफ सर्जिकल इंटरवेंशन बट अगर राइट साइड का है तो आप 2-3 दवाई सोच सकते हैं डॉक्टर यू कैन थिंक डॉक्टर बाबा राइट साइड में द फर्स्ट रेमेडी दैट इज लाइकोपोडियम सेकंड इज रोडोडेंड्रॉन थर्ड इज अब्रोटेनम it has given good results yeah Dr. Mac George for Sumbul yes so I could not remember the name that is Dr. Mac George good there is no any other medicines in breast only size becomes small and blackish color no pain size becomes black, small and blackish blood discharge. जब भी साइज स्मॉल हो गया, ब्लैकिश ब्लड डिस्चार्ज आ रहा है, तो आप एक दो रेमेडी बहुत इंपॉर्टेंट जो सोच सकते हैं, जो फर्स्ट रेमेडी आपको सोचना चाहिए वो है क्रियोसोट, बहुत इंपॉर्टेंट रेमेडी है. ठीक है. So this is how I'm very happy that everybody is now understanding what we have to. And every time I think the one question which everybody wants to ask me is how to study Mathematics and how do I remember Mathematics. The only thing which I would like to tell you again, that keep reading it every day and keep growing in your practice. Don't be fixed with one remedy. Automatically, your Mathematics, your results will increase. Don't have some fixed ideas what others have told you. You can use your head, you can use your differentiation. You can see some of the good cures, transparent good cures, not those cures that you have been heard. Transparent, you have taken the case, you have gone to the doctor, you have shown the doctor, and doctor has shown you result. The transparency of the case is very important, so that exactly that this has been taken care with this medicine. ब्लैक कलर डिस्चार्ज में आप कुछ दवाई और सोच सकते थे, इलैप्स है, क्रियोसोट है, आर्सेनिक है, ये सब के अंदर डिस्चार्ज में ब्लैक ब्लड आता है ब्रेस्ट में. और एक रेमेडी भी है, एक रेमेडी है जो बहुत इंटरेस्टिंग है, जो हम लोग वी यूज फॉर प्रोस्टेट, दैट इज सबल्सर. उसके अंदर लिखे, इट इज रिटन इन दैट इट स्मॉल ब्रेस्ट एंड यू कैन यूज दिस रेमेडी टू इंक्रीज द साइज ऑफ द ब्रेस्ट. ओके. Can you explain what exactly to apply potential differential field for final remedy selection? Often the remedies remaining changing after applying PDF. As I told you, whenever you are taking a case and you have repertorized a case, you repertorize with some symptoms. In the repertory chart, you get about 3-4 remedies. When you have 3-4 remedies, you see that which remedy is the closest and the most similar to the patient, and then prescribe. That is what I do in my practice. From day one, I'm doing this only. And of course, if you are very lucky and if you got some rare symptoms and if you have repertorized in such a way that only one remedy comes to your repertory chart, then of course that remedy is indicated. But don't repertorize like desires sweets, desires eggs, fear of cockroach, fear of reptiles, fear of heights. And if you add this in your repertory chart, so what happens, automatically most of the remedy will go off and only few remedy comes to your repertory chart, and you're very happy, okay, we have got the remedy and only one remedy is come. Take a broad view, 3-4 remedies, then go to the Mathematics and prescribe. That is what I do in my practice, and I have definitely got good results with that. Yeah, Mathematics with the doctor, you can join in biomonthly classes. Yeah, so this is, I take biomonthly classes for one group which Dr. Raha is telling me, so you can join that group also. But for students, I would say first you have to understand and learn the basic Mathematics, and then you can always develop your thoughts and your inputs of that remedy with your practice. So I think that's all for today. I think it's already 3:50, and nice questions, and I hope I could answer and take care of your queries as I always try to do in my YouTube meets. So thank you everybody. Thank you for joining, and meet you next Saturday.